Increase business profit by reducing workers' compensation claims, cost, and lost days. Brought to you by Dr. Gerry Catapang. Work comp claims, secondary to spine and extremity injuries, medically termed musculoskeletal disorders, or MSD, together with lost production and related costs, burden our economy approximately $80 billion a year. Workers' compensation insurance companies state that MSD represents 55% of claims and 65% of cost. That is the bulk of the workers' comp challenge today. Employers can pay out $1 million per year per 500 workers for MSD cost. And the burden of MSD claims and cost on employers has actually closed many workplaces. It can be a threat not only to workforce, but also to their families, causing pain and disability, affecting the physical capability of workers to support their families. Let's explore the challenges and, more importantly, the possible solutions to assist employers in maximizing business profits while lowering workers' comp claims and costs. The challenging world of workers' compensation. Detecting the cause of pain and knowing where the injury actually happened. It is always challenging for the healthcare provider, case manager, and company safety officer to know exactly when and how a work-related injury happened. The information that can be gathered from the employee is subjective. And the biggest workers' comp management mistake is this. The number one factor that determines the cost of workers' compensation, the claim, is not the severity of the injury or the cost of medical management. The number one issue that determines the cost of a workers' comp claim is the attitude of the injured worker's supervisor to whom the employee reports a problem. Therefore, the most important cost-determining factor is the supervisor's response to the initial complaint of pain. How the supervisor receives and reacts when the injured worker claims that the accident occurred at work determines whether the employee will commit to getting better or will have to deal with conflict over the claim. And that determines what the worker's claim will cost the company. The unsympathetic employer will pay a much larger claim cost. It's politics involved in work injury, and they are. Production supervisors must often assume that any and all MSD claims are faked. Because of these assumptions, employees delay reporting pain and injury for fear of intimidation and harassment. This results to increase in treatment cost. Also, workers' comp claims are immediately strained in conflicts such as increasing cost, return to work, and increasing lost days. Secondarily, top management takes an aggressive stance against claims, denying most and refusing workers' return to work until workers 100% recovered. This creates tension throughout the entire workplace, resulting to claims, conflicts, and slow injury recovery. Also, workers themselves often do not believe the claims of their coworkers, annoying the injured workers. This situation leads to severe work conflicts and increasing costs due to slow return to work. Another reason, the misguided mentality that restricted duty workers may slow down production and increase salary costs. The department in which the injured worker is an associate becomes accountable for those costs. This creates resistance to accepting restricted duty workers to the workforce. Finally, companies and their supervisors may restrict workers' access to treatment services in order to prevent a problem from becoming a formal workers' comp claim. This claim may be pushed onto the health insurance policy. This is not legal. A company may allow treatment but pay the medical provider off the books without documenting the injury. This is false record keeping and under OSHA. But there's a solution to the problem. It's detecting the cause of the injury, the key to treatment and management. Pain can be physical, medical, mental, or a combination of all three. And to acquire the best treatment results, it is important to quantify the cause of the pain. Is the cause purely mechanical in origin? Is it a medical condition manifesting as physical pain? Is the cause of pain related to a mental condition? Is it a combination, again, of all three? Is there symptom magnification? And in case there is, what's the plan of action? Number 1, utilize the ideal medical providers to examine and treat your injured workers. Not all medical providers catering to the needs of injured workers are the same. It's true. Physical therapy is now a doctoral profession, and just like the practice of medicine, it has different specialty fields. Not all physical therapists specialize as orthopedic physical therapy and/or industrial rehabilitation. Just as with medical doctors, not all are occupational or physical medicine specialists. This is very important. If your business is located in an HMO healthcare environment, physicians don't have to send your injured worker to their hospital for treatment. It's your company's choice. You decide. Remember, organize the workers' comp team and be involved. The team involves physicians, physical therapists, nurse case managers, company safety officers, supervisors, department heads, and importantly, the injured workers. Physicians are responsible for evaluating and treating diseases. Orthopedic manual physical therapists are responsible for evaluating and treating of physical dysfunctions related to the spine and extremities causing pain. Case managers, supervisors, and department heads assist the injured worker to return to work by helping them find medical and physical treatments they require. Psychiatrists and psychologists also play an important role in pain management. Psychiatrists, MDs, who are specialists in physical medicine, are important medical and rehabilitation experts who can facilitate the return to work at the most appropriate time. The physical recovery from work injuries is a process. The injured worker has a personal responsibility to follow through with the program established to maximize recovery and to minimize, if not prevent, a re-injury. Number 3, be sure to separate the workers who need medical services and those who are just taking advantage of the system. There is a difference. Orthopedic manual physical therapists play an important role in the evaluation of possible movement restrictions in the spine and extremities that can cause and result in neck, back, and extremity pain. They are skilled and trained to detect abnormal movements in the spine and extremities that can be causing that pain. Physical injuries could cause mobility restrictions in the soft tissues, muscle, and joints. These movement limitations will cause the surrounding structures to compensate and cause pain. And once these movement restrictions are examined, identified, and worked on, there is nothing to pull or compensate. Therefore, pain should be less or eliminated. Should the cause of injury be purely physical, patients should start feeling better after just a few, orthopedic physical therapy treatments. If the pain is the same or worse after 3 to 4 treatments, then it's time to reassess, naturally. If this is the case, it is of utmost importance for the physician and the physical therapist to coordinate the patient's treatments. Physicians may need to further examine the patient for possible medical abnormalities and/or more diagnostic procedures need to be performed. Should medical findings be normal and/or movement restrictions in the spine or extremity are back to normal, then the possibility of the patient's emotional reaction to pain can be considered. Use of the McGill Pain Questionnaire during initial assessment is always beneficial. Test results can reveal patients' emotional reaction to pain, possible malingering or faking it, and in relation to physical recovery. This can also be useful to physicians in deciding whether to refer to the injured worker to a psychiatrist and to a pain management program. Avoiding the biggest management mistake. Supervisors' good knowledge and background of MSD can totally change the atmosphere of the workplace. And this can be achieved through neck, arm, and back MSD school programs, as well as supervisor training in managing the injured worker. Once the education and training have been accomplished, it can be noted that the supervisors and management team, with perhaps a few exceptions, and not only have a better understanding of the problem and how to deal with it, they will also have a more constructive attitude towards the claims and issues. Therefore, when the production supervisor understands that today's jobs can create abnormal fatigue and wear and damage to working tissues, a change in perspective can be expected. Supervisors and employers' realization that the vast majority of MSD claims are legitimate will correct this biggest management mistake and save companies, businesses, as well as millions of dollars of workers' compensations cost. Overcoming the politics of work injury. Supervisors' assumptions that MSD injuries are usually fake can be solved by supervisory training, usually during neck arm school or back school by a workers' comp claim prevention specialist. They will then realize the ill effects of these suspicions. It is a fact that 90% of claims are legitimate. but becomes complicated because of the conflicts caused by a few wrong assumptions. Furthermore, when employees receive proper education on MSD and when they understand that avoiding injuries is a personal responsibility of theirs, then reduction of more claims can be expected. It stands to reason. Top management realization that injured workers don't have to return to work until 100% recovered has a big effect on company profits and, importantly, morale. Educating workers during training sessions, such as neck and arm school, back school, or ergonomics team training, shows that most claims are legitimate. It's very vital for them to know that their attitudes can be a tremendous source of conflict, affect their co-workers' recovery, and increase expense to their company. And they could be next. Employers' understanding of the importance of a restricted duty program is very important in reducing workers' comp costs as well. It is important for them to realize that wrong assumptions and mentalities in the workplace have to be corrected before restricted duty can proceed. Furthermore, specific policies and procedures must be written and the program must be precisely supervised. The department that pays the restricted duty worker's salary must be set to facilitate the worker's return to his or her original job and gain supervisor cooperation. Companies need to realize the consequences of not providing appropriate medical care and how the employee's morale can be affected by this. They may need to know that 90% of OSHA inspections are generated by a call from an angry worker. Companies should not set a goal of no reported injuries. Rather, they should use no lost time as their goal. Maximize profit by reducing workers' comp claims, cost, and lost work days. But how to use and utilize rehab programs that prevent injuries and reduce workers' comp claims. There are available orthopedic physical therapy, industrial rehabilitation, and return to work programs that would help companies maximize business profits by reducing workers' comp claims. Some of these programs include, but are not limited to, MSD risk analysis, back and neck arm MSD school, supervisor management employee training, on-site problem-solving consulting, on-site pain intervention service, new hire training and spine extremity screening, stretching program, restrictive duty program development, work conditioning and functional capacity evaluations, on-site physical therapy clinic, preferred physical therapy provider agreements, and the OSHA 300 log analysis. In conclusion, MSD is a complex and expensive problem. Employers and supervisors succeed in dealing with it through knowledge. They have to become an expert on it in order to control it, period. There is an available MSD and management training for it in the industrial rehabilitation world. Workers' comp claims prevention specialist's job is to make the management team experts on dealing with MSD claims and cost, plus make employees committed experts on the working and aging body. U.S. Workers' Compensation Claims Prevention Specialist PC, located at 3003 East Chestnut Expressway, Suite 150 in Springfield, Missouri, 65802. For more information, call 417-865-0011. It's true. Dr. Catapang's No Lost Time program has an average of 72% reduction in MSD lost work days in over 600 workplaces in the last 30 years. Amazing. Dr. Gerry Catapang, PT, DPT, MGS, is the president and founder of U.S. Workers' Compensation Claims Prevention Specialties and a subsidiary of Physical Therapy Care, Manual PT, and Industrial Rehab Center, PC, in Springfield, Missouri. Dr. Catapang has been practicing for over 22 years. Be sure and visit them on the web at www.smartcarept.com. Thanks for listening.